It can take a little practice and patience, but breastfeeding is the healthiest choice for your baby and for you. Feed your baby every 1 to 3 hours or whenever hungry. Some babies may want to feed more often at certain times of the day and during growth spurts. Hunger signs include sucking on fists, fussing, or turning toward the breast. Crying is a late sign of hunger. First, find a comfortable spot to breastfeed. Use pillows for support if needed. A nursing pillow can help support your baby. Laying your baby in just a diaper on your bare chest or belly is called skin-to-skin contact. This can soothe fussy babies and make it easier for them to latch or attach onto the breast. Choose a comfortable nursing position. Just make sure that your baby's head and neck are well supported. Next, line up your baby's nose with your nipple. Support your breast with one hand and your baby's head with the other. As the baby's mouth opens wide, gently bring your baby's head to the nipple. This helps your baby get a good latch. Your areola, the dark circle of skin around the nipple, should be mostly inside your baby's mouth. Once sucking begins, you'll feel a tugging feeling. After a few minutes, your milk will start flowing. This is called letdown. You can tell if your baby is swallowing by seeing movement of the lower jaw. When babies are done on one side, they may release the nipple or stop drinking and fall asleep at the breast. If your baby doesn't release, slip a clean finger into the corner of the baby's mouth. This will break the seal. Burp your baby and switch to the other breast. Burp again at the end of the feeding. Breastfeeding shouldn't hurt. If you feel pain or discomfort for more than 20 seconds, remove your baby from the breast and try again. Always call your doctor or lactation consultant if breastfeeding is still painful. Your breasts or nipples are sore, swollen, red, cracked, or bleeding, or if your baby doesn't wake to feed, isn't satisfied after feedings, or has fewer wet or soiled diapers than your doctor recommends. Breastfeeding comes easily for many moms, but others need time to get the hang of it. Your doctor, lactation consultant, and other breastfeeding moms can offer support and advice along the way.